5 years old. I need more shock. Much better. But I was running the congressman's office when I was 33, and I was an ancient grizzled hill veteran. Oldest person most of the staff had ever seen. And that's the kind of experience you get in DC, but they are super bright and super smart. So just expect that, appreciate it, because they are the ones that are going to have that relationship with the congressman that you want to be able to take advantage of. Yeah?
Don't you think most congressmen, senators have a list of key people, and you want to become one of those key people on the list?
Exactly. That's an excellent point. That the members of Congress have sort of a list, and their staff. I wouldn't just limit it to members.
Staff create the list often, right?
Well, yeah, and it's not even like an actual list.
Right.
It's like what you really want to get out of this meeting is that the staff, most of the staff have stored in their head the list of people that know a bunch of stuff. And they don't need to know everything you know. They just need to know that you exist and you know it, and that they can find you when they need you. So that's what they're storing in their head. It's not all the little details. They just want to know, all right, I know Joseph, and he seems smart, and he's got some good information on how this impacts our district, and I know his phone number or his email address. That's what you want to walk away from these meetings with. And it's absolutely that sort of internal list. I used to call it the internal Rolodex, but no one knows what Rolodexes are anymore. So I talk to a crowd and they'll be like, Rolodex, what's that? I'm like, okay, never mind. But you want to be on that Rolodex. All right, so telling the story, the SPIT technique. SPIT is an acronym because we must have our daily acronym in DC. This is our acronym for today, the SPIT. The S is for specific. Be able to answer that specific question. Why are you there? What is it that connects what you do in the district to what they do in DC? Specifically. Not, hey, we do housing stuff, isn't it great? Or, hey, we're having really crappy weather, you know? I'm sorry it's raining during the cherry blossom season. I mean, I would have people come in and say that to me. I'm like, really? Really? You came all the way to DC to say this to me? Be very specific. The P is for personal. You all have wonderful personal stories, I'm sure. And let me tell you the power of a personal story. So I mentioned one of the issues I worked on was animal welfare. And there was legislation to make it a federal crime to steal someone's pet from a backyard and sell it to a research facility. Okay, so before I go on, is anyone for the stealing of pets? It's not like you look at this and you're like, am I for it or against it? I'm not sure. But we were getting postcards, and the postcard said, 10,000 pets were stolen a year or whatever, but they didn't really, I looked at it and I'm like, oh, that's terrible. I'm going to put these aside. I'm going to, deal with them, later. But then we got a letter from a woman in our district, and her pet had been stolen. And she sent a pet picture. It was a little black Labrador retriever puppy. And then she said in the letter that she had kids. And she asked, how am I supposed to tell my kids what happened to the puppy? And I was like, I don't know. Oh my God, we've got to pass this bill right now. And I'm like paging the congressman. And he's like, it's midnight. We don't need to pass it right this moment. But the point is, that personal letter captured my attention. And it was that personal story that really did it. And you guys have thousands of personal stories, people you've helped, people who, would not be able to be contributors to society if not for the services that you provide. So you need to be able to tell some of those personal stories. And if you can work puppies and children into those personal stories, you really should. Puppies and children. The puppies and children rule. All right, the I is for informative. And you do need to wrap some facts and figures around your personal stories. So, to the extent you can look at some of the state information. I know you all have your own information about, your local authorities and how many people they benefit and how many units you have, et cetera, et cetera. So those facts and figures will be useful. And the T is for trustworthy. As Nathan was saying, you really want to build that relationship of trust. And you do that not just through this one meeting you're going to have here in DC, it's over time. How many people in the room asked their spouse to marry them on their first date?
I wanted to, but I didn't.
You wanted to, but you didn't. Wise move, wise move. Did she marry you eventually?
Oh, yes.
Okay, good, good.
Yeah. She acted like she wasn't paying me attention, and so I saw
See, that works.
I saw this football player one day, and I just caught her by the arm and told her to keep walking. She said, "But you can't do it." I said, "Yes, I can."
See, that's what works with women, you know? I mean, women do that with men because we're like, yeah, if I ignore him,
I'm glad she's not here to hear me say it.
Right now, it's on camera, though. I just want to tell you that. Oh, you are so busted. All right, but the point is that, you know, a lot of times we walk into our legislator's office and we're like, "Hi, can I have $13 billion? And they say, no. You're like, man, Congress sucks. No one ever listens to me. I never get what I want. It's like, well, you don't know this person. You just asked them for $13 billion. Of course, you know. You need to build that relationship of trust over time. So that's the spit technique. Now, how we're going to use this is, I know I promised you we were going to practice some meetings here. So I've got this sort of formula for you. We're not going to do the whole 7 minutes or 9 minutes or whatever it works out to, 9 minutes. But I want you to structure something based on this, and we're going to have a couple practice runs, and they will be amazing. I have a prize of such fabulous magnitude, it's like nothing you've seen yet. So there's a greeting, which is like, hello, my name is, and then you say your name. Make sure you make the point that you're from the local community. You're not just here for the national conference, you're here from their community. Getting to know you, like spend a minute on that. You will, find legislators who are like, oh, you know that bakery down on Main Street? I love that bakery. They have the best bear claws. And, I'm sure that, when we talk about housing, we've got folks who need to, make sure that they get baked items. And, oh, look at that. Well, I got to go. You have that, long conversation about the district, and you haven't really gotten to what it is that you want to talk about. Background on you and your issues, that's where you give, your mission, and a couple words about a couple really relevant projects in the district that are relevant to that legislator. So like we were saying earlier, if you got the healthcare legislator, you talk about the 5 healthy homes. If you've got the technology legislator, you talk about the technology centers that you're trying to put in. You pick those stories based on what's relevant to the legislator, and of course what's relevant to the current issues, appropriations, etc. that we're talking about. The ask. Now the ask is, it could be, hey, if you're here and you're not using federal funds, you can go in and say, hey, we want this level of appropriations. If you feel uncomfortable with that, you can say, hey, as you're considering the FY 2013 appropriations, we want to make sure you know how these play out in the district. Can you come and visit a CDBG program in our district? And that is still an ask, and it's connecting back to the work that the Congress is doing. Why you think that ask is important? We think this is important to the people you represent because that's where you tell that little personal story. Let me tell you about Bobby, who was going to lose his dog if he didn't have our housing facility where he could go and live with his dog, blah, 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 blah. I'd work dogs in there because that's going to be relevant. Yes?
Concerning the personal story, we do a lot of video work, and we have stories of our people online. Do you think that folks would like to have a link over to that person?
Yes, I would absolutely just tell the story verbally in a minute or so, and then say on your one-pager, have maybe a screenshot of that video and the link, and just say learn more about so and so. Visit this link, because they love that stuff. They don't want you to show them a website because they can kind of see a website on their own, but to know where that information is, absolutely. Yeah.
I think a shortcut to background is a thank you for any previous work that has been done with this member.
Absolutely. A thank you if they've done, and when we were talking about champions and supporters and neutrals and opposed, and when you go in and you know where they are, absolutely. Starting with a thank you if they've been in one of the good categories makes a lot of sense. Follow-up ideas, this is where you suggest some ways to follow up, because they're going to say all kinds of nice things, and then you're going to walk out the door, and they're probably not going to remember you unless you contact them again and say, Remember that great conversation we had about housing reform? Well, I remember how I said, hey, would you want to come and visit something? I see a congressional district work period's coming up. Would you be willing to come and visit us during that work period? If you want to know when the work periods are, if you go to the House.gov and Senate.gov sites, there's a calendar. And that shows you when members of Congress are in DC and when members of Congress are in their district or state. And when they're in there, and we'll talk a little bit about how to set up district meetings, etc. in a moment. But come up with some of those follow-up ideas. Make sure you've got that ask in there again, and make sure you get their contact information. And when you're getting their contact information, ask them, how do you prefer I contact you? Do you like email? Do you like phone calls? Do you like meetings? Do you like to be tweeted or whatever the kids do?
Facebook.
Whatever. Do you like to bump? Isn't there some bump thing? Someone said, hey, do you want to bump? I'm like, really? What are you talking about? Because it makes me nervous. But it's apparently an app, just so you know. It's like an app on the phone. But the point is, figure out how they want to be communicated with and then choose that method of communication. So, at your tables, and again, if you didn't like your table, go find another table, but don't make the first table feel bad. Come up with a plan for a meeting. You're going to meet with me. What do you know about me already that you can work into this? We talked about dog. What's my dog's name?
Ozzy.
Ozzy. Very good. He's an Australian cattle dog. Just super cute. So if you can work that in, try and work that in. Let's also say I'm very interested in, let's use healthcare. I am interested in healthcare. So let's use healthcare as one of those policy hooks that you might want to make.
I read your book.
You could say that too, and I would be very happy. All right, so I'm just going to give you like 3 minutes to come up with this plan for this meeting, and then we're going to have some volunteers. Okay, so ready? Go. All right, hi.
I'll go with you.
I'm Congresswoman Vance.
I'm Kathy Rankin.
Hi, Kathy.
I'm John.
Hi, John. Nice to meet you.
Imogene.
Hi, Imogene. Nice to meet you. Listen, I need to walk to a vote. Do you mind walking and talking?
Sure.
Okay, let's go.
Thanks. Well, Congresswoman, we are good from your district down in Minnesota, and we wanted to take just.
I love my district. It's great. It's such a wonderful district, don't you think?
Yes, it is.
And you know, Minnesota with the mosquitoes this time of year, it's going to be rough, but
Well, yeah, we can solve some of the problems with mosquitoes by resolving some of the issues in the swamps that we have around our public housing units.
oh, nice, nice, nice.
We're going to broach that issue, which is an obvious health issue.
Well, yeah, and I love healthcare.
Well, and
I mean, I think health is good.
we'd heard a rumor about that. But yeah, the biggest problem is, again, with some of the capital issues that we face with erosion and leaving open spaces for open water. Oh, excuse me, sir.
Oh, hey, how you doing? It's so good to see you.
But again, some of the biggest concerns for us, obviously, are those health issues that we face because of lack of capital issues and the ability to resolve the capital funding issues that we have.
Oh,
We
so-
firmly believe that if we can solve some of those, we can help solve some of the health insurance cost issues.
Oh, I love solving health insurance costs. I mean, I think that, you know, boy, our health insurance costs are high, and I want my people to have access to health care. I think health care is good.
Well, we think it's pretty clear, too, that it's been shown time and time again that healthy homes, safe and decent environments, create safe and healthy children, adults,
And puppies?
health issues, and puppies, and we did actually develop a health insurance program for some of the puppies in public housing. Because we found that sometimes the health issues of the puppies come off on the people as well.
Yes.
And,
Totally see that.
and I tell you, there's nothing like the look of that little puppy. All the little public housing she's
With the puppy? Oh my God. Okay. Let me whip out the checkbook. All right.
But the fact is that what we're asking, we're not asking for the moon. We understand there's a, $300 billion backlog in capital needs.
Yeah, that's what I hear.
We're probably not going to get you right a check for that today.
No, probably not.
But you know what we are asking for? Something simple. We're just asking you to consider to support at least full funding or as close to full funding as we can get. Bring those dollars and cents back up to where we can actually have an impact. We firmly believe that the money that you spend on this side will save money on the healthcare side.
Well,
That's the fact of it.
I'm for saving money. I mean, I'm a big fan of that.
You spend a little to save a lot. And, you know, you look at the impact upon the health, you look at the impact upon the economics side of it, because we do create some jobs, we offer some opportunities to our people. That alone, that getting them out, getting them into the workforce again, that promotes great health as well. So,
Wow, it sounds great. Yeah, and I'm looking forward. I really need to learn a lot more about this. I'm running in to vote right now, but let's follow
what
up.
we'd like you to do though is come down. We got a little dog named Max.
A little dog named Max.
He's only got 1.5 legs left.
A little homeless sick dog named Mac. Okay.
You know the water that's been pooling because of the lack of capital funding, those mosquitoes, they're big enough to drag him into the bushes.